right, so you did tell me that you currently live with your husband and your
Yes.
2 children. What's your occupation?
I'm a registered nurse.
Okay.
I teach at a university.
Oh, okay, great. Your husband, does he work also?
Yes, he's a surgical technologist, works for a plastic surgeon.
Both work full-time?
Yes.
Any financial stressors in your life right
No.
now?
We're good.
Okay. Any other stressors that are...
Work
Yeah.
every once in a while is a stress, as it is with anybody, but besides that, no.
Okay. We talked about your diet, and you do incorporate fruits and vegetables. Do you exercise?
Yes, 3 times a week I walk on a treadmill.
Okay, wonderful. Do you have your own treadmill at
Yes.
home? Or?
Mm-hmm.
That's great. Do you or have you ever smoked?
No.
Do you wear a seatbelt in
Yes.
the car?
Yes.
Do you drink alcohol?
No, maybe 1 drink at a holiday. That's about it.
Okay. And any street drug use? Have you ever in the past?
No, never.
No. In your home, do you have smoke detectors?
Yes.
And how about carbon monoxide detectors?
No. Mm-mm.
So I know since you're in the medical profession, you probably receive additional vaccinations. Do you receive a yearly flu shot?
Yes.
Did you get one this year?
Yes, I did.
Okay. Are you current on tetanus?
Yes.
Do you know the last time you had a tetanus shot?
Tetanus was probably 3 years ago.
Okay, wonderful. And hepatitis B?
Yes, current on hepatitis B.
Okay. Do you see your PCP regularly?
Once a year,
And how about gynae visits?
about every 2 years.
And when are you next due?
July
July of this year?
of this year, yes.
Okay. And with your gynae visits, I'm assuming you have pap smears as well? Have you ever had an abnormal pap?
Nope.
How about exposure to the sun? Do you like to go out in the sun?
Not really. I avoid the sun.
Okay. When you are out, do you use sunscreen?
Yes.
Okay. And over the last 2 weeks, have you had feelings of decreased pleasure or interest in doing things? Over the past 2 weeks, have you had any feelings of being down or depressed or hopeless?
Nope.
Have you ever had any psychiatric problems? All right. The next few questions I'm going to ask you are just related to your health in general. First, I want to ask you about your skin. Have you noticed any rashes or any other changes in moles in your skin lately?
No.
And I see you wear glasses. Do you wear those all the time?
Yes.
And do you have regular eye checkups?
Yes.
How
Yearly.
often? Yearly? Great. Any problem with hearing?
No.
Pain in your ears or drainage?
No.
And I know you did tell me that you had a 2-week history of congestion and a runny nose. Any other symptoms related to your nose or your sinuses?
No.
And do you see the dentist regularly?
Yes.
And how often do you
Twice
see
a year.
And when's the last you saw your dentist?
I'm due to go in June.
And any problems with your mouth or your teeth right now? Your throat, sore throats? Just that scratchiness that you said?
Yeah.
Do you perform self-breast exams?
No, I do not.
Have you ever noticed or been told that you have lumps in your breast? Any pain or discharge that you've noticed? Does your gynecologist perform breast exams? Okay. I know we talked about your lungs and you've had this cough. Have you been experiencing any shortness of breath or wheezing that's associated with that? And I know you told me you have never been diagnosed with heart disease or high blood pressure. Do you have your blood pressure taken regularly?
At my PCP.
Okay. Do you know what your blood pressure typically runs?
I'm a little low. Normally I was probably about 110/60 last time I had it checked.
Okay. And your appetite, how would you say?
Good.
It's good. And I know we talked about your diet and things that you tend to avoid. Do you have any problems with nausea, vomiting, or indigestion?
No.
How about your bowels? Any problems with your bowel movements?
Regular.
Any rectal bleeding that you've ever noticed or pain?
No.
Okay. What about making urine frequency, urgency, any painful urination?
No problem there.
And have you ever been told that you have thyroid disease or
No.
diabetes?
No.
Any problems with cold intolerance?
No.
Unexplained sweats?
No.
Have you ever had your thyroid checked?
Yes, yearly I get my thyroid and my fasting blood sugar checked and they've been normal.
Okay, great. Have you ever had a blood transfusion?
No.
Have you noticed any unusual bruising?
No.
And any muscle or joint pain or stiffness that you're noticing regularly? Ever had any episodes of fainting?
No.
Seizures that you're aware of? Any numbness or tingling anywhere?
Nope.
And any problems with your memory?
No.
Well, that's all the questions that I have. Is there anything that I failed to ask you that you need to tell me about?
Nope, I don't think so. You got it all.
Okay, wonderful. Thank you so much for your
Okay,
time.
all
Very
right.
nice to have met
Thank
you.
you. Thank you.